Being a Foundation Radiologist means you are at the forefront of an innovative approach to radiology, one that incorporates efficiency, quality, and consistency.
Thank you for calling Foundation Radiology Group. This is Taylor speaking. How can I help you?
It allows you to focus on what made you love radiology in the first place, helping patients by solving the visual puzzle that is radiology.
The major advantage is that Foundation Radiology removes obstacles that keep you from doing what you like to do as a radiologist. And you get to remain focused on patient care without being bogged down with administrative duties.
Here at Foundation Radiology Group, you have an opportunity to help innovate the way radiology is practiced. Whether you're catching an early diagnosis or interpreting a stat image, you have the ability to do what you were trained to do: care for, improve, and often save the lives of patients.
Foundation Radiology provides a great supportive environment which enables me to focus on what I enjoy most, providing patient care. We have a highly skilled support staff centrally located in our headquarters in Pittsburgh who are immediately available to us to help with report generation and connecting with referring physicians.
I'm heading into my 11th year at Foundation Radiology. I started as medical director of our initial client hospital. As we grew, there were more roles to be filled, and I took on Director of Interventional Radiology. And from there, Associate CMO.
Having fellowship-trained subspecialist radiologists allows us to provide a higher level of interpretation that suits the ordering physician and addresses patients' needs.
Hi, I'm Dr. Benjamin Harris, and I'm a Foundation Radiologist. When I came out of residency and fellowship training, one of the qualities that I was looking for in a practice was one that was able to utilize as much of what I had learned in training and apply that to my everyday practice. My fellowship training was concentrated mostly in body and breast imaging, so I was comfortable reading difficult cases in those areas at a particularly high level, and certainly wanted to maintain that as a strength in my own practice.
I'm able to spend my professional life practicing what I enjoy. I read general studies, plus a lot of nuclear medicine.
Our system allows our off-site set specialists to handle the high volumes of both the stat and routine cases and allows me in my role as the interventionist to focus on patient care.
Foundation not only has a model that is able to utilize readers like myself that have subspecialized training and demonstrate competency in other areas, it uses readers like me in a way that optimizes the practice for both of us.
As a musculoskeletal radiologist, I know what the orthopedists are looking for, and that can really make a difference in a patient's outcome.
I've worked for Foundation Radiology for more than 4 years as part of a large group of breast imagers who are either fellowship trained or highly experienced in breast imaging and breast intervention.
Foundation's approach to radiology affords me the luxury to focus on what I'm trained to do by reducing administrative work to the bare minimum.
Foundation Radiology has a large team of radiology support specialists and general extenders that work with radiologists in real time, prepping our reports with standard templates, connecting us with our clinical partners or technologists directly by phone, allowing radiologists access to editors in addition to voice recognition technology. This is the type of support that enables our radiologists to focus on their practice and not be distracted by administrative tasks.
And that is just one example of the mutual respect within this physician corporate hybrid model that separates us from and elevates us above other corporate entities and even traditional private practice.
My favorite part of being a radiologist at Foundation is the ability to work in an environment that supports work-life balance while providing quality patient care.
One of the things I'm most passionate about is quality. As Director of Quality at Foundation, I get to explore different methods of improving what we do and how we do it. We have a robust quality program here at Foundation that emphasizes improving every radiologist in our group. We recognize that zero error is a fallacy. Error is inevitable, but it's how we deal with that error and the ways we try to minimize it that really set us apart as a company. In a non-punitive way, we have created a program that allows us to learn from each other's mistakes, making every single one of us better at what we do.
The great thing about Foundation is that they can really tailor your experience not just to your subspecialty training, but also to fit your own lifestyle and career goals. If you want to work a little extra over your allotted shift for extra pay, that's an option that is widely available on a daily basis. If you want to work from home and read as an off-site radiologist, they can tailor that workflow and volume to fit that preference. And if you like to go into work at the hospital, do procedures, lecture at conferences, there's a wide array of in-house experiences at hospitals and imaging centers that can achieve that.
With our new academic associations, we have every reason to expect the breadth of opportunity for professional development to keep on growing.
I practice as a high-level body and breast imager while also reading enough brain, spine, and neck to not just maintain competency in those areas, but to grow my knowledge base over time. It's a rare thing to find in a modern radiology practice, and I found that with Foundation Radiology.
Foundation Radiology enables radiologists to focus on what they were trained to do, what they like to do, and what they do best.
I really love what I do, and being with Foundation is a huge part of that.
We invite you to be a part of our radiology team at Foundation Radiology Group.
Yeah, we can get that done, Superstat. We'll give you a call back. Thanks. Bye.